Hi, my name is Maria Harlow. I am an LPN and I would like to present my project, which is the implementation of electronic medical records at our facility. In today's presentation, I will talk about multiple ramifications of paper medical records, which include risk for misfiled or lost records, also risk for inappropriate access, risk for financial penalties, and risk for medication errors. Then I will present the solution to the above problems, which is the implementation of electronic medical records. I will cover the budget, and in the end I will conclude with multiple benefits of such innovation. In the end of the presentation, I will be happy to answer any questions. Paper records are very hard to track and keep hold of, especially if certain pieces fall out or get misplaced or accidentally taken out of facility. According to U.S. Department of Health and Human Services, the sheer volume of records increases the likelihood that records are lost because they are incorrectly filed or never returned to the room. And although there are still many facilities that still implement a conventional method of keeping patients' records, for instance, paper records, handwritten orders, flow sheets, in today's age of growing technology and informatics, paper medical records really stay on the way of quality control and safe patient care. The next ramification of paper medical records is inappropriate access. According to U.S. Department of Health and Human Services, anyone who has access to paper medical records can remove pages, add entries, erase, or otherwise tamper with authentic entries. Paper medical records possess the increased risk for unauthorized access to record storage areas, such as finding records on the counters, exam rooms, or copy machines, receiving misdirected faxes, copies, and other similar events. And this inappropriate access can be both intentional and unintentional, but in any way, it is a high risk for HIPAA violation. The next ramification is risk for financial penalties because Centers for Medicare and Medicaid say that all organizations in the healthcare industry have until January 2015 to adopt electronic medical records format. And those physicians who neglect to follow the mandate will face financial penalties. The government plans to assess 1% deductions of Medicare reimbursements in 2015, and the penalty will increase to 2% in 2016 and 3% in 2017 and up to 4% in 2018. The next ramification is increased risk for medication errors. As we all know that medication errors are very common, they're expensive, and they're very harmful for patient and his or her family. Handwritten orders often illegible or incomplete and cannot ensure the intended interpretation and transcription. Therefore, paper medical records increase the risk for medication errors and can result in adverse patient event. According to Center for Disease Control and Prevention, in the United States, medication errors are estimated to harm at least 1.5 million patients per year, with about 400,000 preventable adverse events. And another good thing to know is medication errors really can be prevented. The best way to improve the quality of patient care and reduce multiple security and safety related risk is really to invest in electronic health records implementation at our facility, and this includes buying additional equipment, training the employees on the use of a new computer system, and also transferring the data from paper medical records to the electronic form. But overall, electronic medical records are way more secure and safer for the patients. They do not possess such a risk as paper medical records to patient privacy. If we implement electronic medical records, we will get incentive payments from Center of Medicare and Medicaid, and multiple reimbursements to follow. Really, electronic medical records is the way to provide safe patient care. In order to implement electronic medical records in our facility, we will need 6 mobile technology cards, 2 cards per floor, with installed electronic health records software, and also we need 3 automated medication management systems. Mobile technology cards you can see on this slide, those will be the Altus laptop card. And they are really simple and easy to make height adjustment. They are really easily transferable from patient room to patient room. They have ergonomic features. There are multiple additions that can be put in, like sharps container and drawers. Also appropriately sized holders for glove boxes, sandy wipes, computer mice, and sharps container, and also the bar scanner. Those computers have antimicrobial finishes built in the card painted surface materials, which will help with infection control. On this slide, you see the automated medication management system, which is the Texas MedStation 4000 system. And the reason I chose this system over others is because this system really helps start patient therapies faster by reducing time to the first dose, and also it gives the nurses fast and easy access to the medication they administer. The safety feature includes that pre-selected medications and document waste is recorded in the system, and the system always warns you if there is any potential mistake or any potential adverse effects is about to happen. The electronic medical record software will be the Cerner long-term care solutions. This software has a power chart that helps consolidate resident health information into a single person-centered electronic health records that can be accessed from anywhere, and it also multiple providers can access it simultaneously. On this page, you can see the budget information for the project implementation. The total cost of electronic medical records implementation for our practice will be $171,957, which includes vendor, hardware, and training costs, and also other costs. To break down this cost, $50,000 will go to vendor costs, which is the Cerner's long-term care software interface. Hardware costs will split between the Altus laptop cards, which will be $6,260, and the Pexis medication system for 3 of them, it will be $65,697. For half-time for 1 year of project manager fee is $25,000. Charting and scanning and transferring the information from paper charts to electronic form will total to $5,000, and also the training staff fee will be $15,000. Other minor costs will be wiring, surge protectors, and that will be $5,000. To conclude, I would like to say that electronic medical records adoption at our facility can give healthcare providers accurate and complete information about patients' health, ability to quickly provide care, and also the ability to better coordinate care between the providers. Electronic medical records can also flag potentially dangerous drug interactions, verify medications, dosages, reduce the need for potentially risky tests and procedures. And overall benefits of electronic medical records include increased safety and greater quality care for our residents. If you have any questions, I will be very happy to answer them. Thank you so much for your time.